So now we're moving into the Q&A session, and you'll, as you've been doing already, you can post questions into the Q&A section that you'll find on the web page. And what I'll be doing is I'll be inviting each panelist to address the questions most relevant to them. A few I think I'll be able to answer myself. And the question, you'll also see the question on your screen. So we're going to be taking them in the order in which they've been submitted so that we can keep organised. Yeah, I think that's it. I think that's all we need to remember so far. And this Q&A session is going to last for 30 minutes, and after that there'll be a lunch break before we'll all be back together again for the second half of the symposium. So the first question is straightforward. It's will the slides be available afterwards? And the slides from my introductory presentation and from the presentation by Professor Robin May, those slides will be available, and you can see there should be an icon available on the screen next to the presentation slot, and you should be able to download those. So yes, they will be available. Right, so let's move on to some questions. So first we've got a series of questions for Adam Fox about different aspects of his presentation. So obviously people are very keen to explore some of those themes that he discussed, and in particular in the relationship between childhood and adult allergy and food hypersensitivity. So the first question is, do non-IgE delayed responses continue into adulthood? So if I could invite you, Adam, to answer that question for us.
Thanks. So delayed type, these non-IgE mediated allergies are classically an issue relating to early childhood. So if you look at the best studies relating to the natural history of delayed allergy, and the most common delayed allergy that we see in early childhood is delayed milk allergy. There was a very nice Israeli study some years ago that looked at a very large cohort of children with from birth with a range of different milk-related issues, that followed them up with regards to both IgE and non-IgE mediated milk allergy. And they had about 50 kids, which is the largest series I'm aware of, that they followed up with delayed milk allergy. And what they found is that about half of them had grown out of it by around 12 to 18 months, most of them 75% by 2, and pretty much all of them by the age of 3. Now, I remember very distinctly talking about that data in front of a large audience of parents at something called the Allergy and Free From show. And just as I finished that sentence, I think about half the room's hands went up. And it turned out that what they were all about to tell me was that, but why hasn't my child outgrown it yet? And they're 4 or 5 or 6, and nicely illustrating that what you read in the academic articles aren't necessarily always directly how it feels in the real world. So clearly there are a group of stragglers. It's been nicely described in some of the American literature, showing that some of the kids who don't quite obey the rules when it comes to the allergy testing with delayed allergies. So by rights, anyone with a delayed allergy to milk ought to be negative on their allergy tests, because those are tests for immediate type allergies. But sometimes they have little positives, and that's associated with a more persistent type of delayed milk allergy that can last a little longer. But we still typically see them outgrowing it when they're 5, 6 or 7. So I'd never say never. Of course, there's always going to be a small number of people where it continues, but for the overwhelming majority, this is still an early childhood issue.
Thanks very much. That's a really helpful and clear answer. Another question about children and adults. So you mentioned desensitisation treatments for children. Could you say a bit about treatments in the pipeline for adults?
Sure. I mean, I think we're really at the beginning of the story for this. So it's not just that there's different ways of desensitising, there's also a lot of interest in desensitising different groups. Now, if you go back to the large earlier peanut desensitisation studies, they were from kids aged 4 all the way up to adults aged 55. And actually what they found relatively early on is that the older patients, the adults, had more significant reactions, were more likely to not be able to increase their doses successfully, and were less likely to sort of reach the end point of a decent dose of peanuts. And interestingly, those studies then sort of progressed in the next phases, excluding the adults, because they were sort of dragging the results down as such. And I think that's a real shame, because of course it means that there's been less advance in terms of opportunities to offer them treatment. So Palforzia, this new peanut desensitisation that's actually got a license, that's only from age 4 to 17. But there are, I think there's FSA funded studies. There's certainly studies going on looking at peanut desensitization in adults to explore whether it is feasible and practical. And then, of course, because there are other ways of desensitizing coming onto the scene as well. So the idea of desensitizing alongside monoclonal antibodies, so things like omalizumab, which really dampen down any allergic reactions, it could well mean that it opens up desensitization to patients that previously would have been too reactive and there'd have been too much risk of allergic reaction. Maybe there's a chance of doing it. So there's a lot of interest. I think it must be very frustrating for patients who have had an allergy all their life and now in adulthood, seeing all of these advances happening that have sort of come a little bit too late for them, but there is still interest there. But in truth, I think if I imagine what my life as a practicing allergy clinician is going to be like in 5 to 10 years' time, I think there'll be an enormous focus on desensitizing younger children very soon after diagnosis, and probably less of a focus on kids as they get older and go into adulthood.
Good. That's well, yeah. So good to hear, and I agree. I mean, it must be so very positive that there are new treatments coming on stream for younger children. Difficult, I think, for those of you living with an adult food allergy or hypersensitivity. But that's good to hear. Good to hear your overview. And then final question relating to the specifics of allergy. Somebody interested to learn more about research carried out on the effects of different milk proteins, and they mention something called A2 milk. I wonder if you could just give us a bit of context before answering that question, because that sounds as though it may be a little bit technical.
Yeah, so A2 milk is a milk that has been available for a number of years. I think it originated in Australia. It was around in the UK probably up till about 2 or 3 years ago. I've not seen it for some time. I think it's available in China and the US, but the difference is it's been engineered to have a little bit of a change in one of the type of beta casein proteins, so that rather than being what's called an A1 beta casein, which is I think what's present in most in cow's milk normally, it's a slightly different one that's present in other type of animal milks. I think the thing to be really clear about is that it is never appropriate for somebody with a milk allergy. Anybody that's allergic to regular milk will also be allergic to A2 milk. The claims of A2 milk are actually not around it. They don't claim to be hypoallergenic. What they claim is other health benefits, which I'm not going to claim any expertise on. I've not cited on any convincing ones. I'll let you read into that as you will. But I think it's more of a sort of an alternative in terms of more general digestive health. It's certainly not something that I'd in any way consider for a child with a milk allergy.
Yeah, that's a really
avoid milk.
Really helpful and clear answer there. That from an allergy perspective, there's not a difference in these different milks. Thank you very much. So moving on then. So a question for you, Robin, and also a question that says, great presentation. So thank you for that. But around allergy labelling, allergy labels, obviously they say what the allergen is, that's highlighted on the label, but they don't provide information about the quantity of allergen that may be present. Would this type of information be useful to the consumer, or could it possibly cause more confusion if a hypersensitive consumer decided that they might be willing to take a risk? So I think there are two parts to this. I wonder if you could say a little bit about the feasibility or the desirability of including the allergy quantifying allergen information. I don't know, also invite perhaps Rebecca and Adam if they have any observations about what's most useful to consumers given the current state of knowledge. Robin.
Thank you very much, Rebecca, and for that question. I'm hoping I'll be able to get my answer out without either the builders or the dogs deciding to contribute, so apologies in advance if I disappear in a flurry of banging and barking. I think there are a couple of things here. I mean, so firstly on the science, I would say the tools do exist to quantify allergens down to really quite low levels. They are typically done, in a laboratory setting that is relatively straightforward. In a large-scale food manufacturing situation, I think it gets much more challenging. I mean, it would be hard to imagine, for example, a large bakery producing thousands of loaves an hour doing a sort of detailed mass spectrometry analysis of every loaf to look for, contaminating peanut residue, for instance. So I think the first problem in terms of the science is, although it's feasible, it's probably not economically feasible or doable at scale at present. So we would need to be very careful about that. On the labelling specifically, absolutely, we are hugely committed at FSA to transparency right through the food system. So the more useful information we can get on a food label, the better, I think. And that may well contain some kind of quantification information. And I do think that's useful to some consumers who will be able to make a kind of risk judgment. And of course, we do that all the time about food. We don't ban, for example, alcohol, even though alcohol is, it clearly has negative consequences. We leave it up to individual people to make a decision about their own health. And I think allergies fall into that same group. The thing that I would be very concerned about, though, is to make sure that labelling is absolutely accurate so that people do have the information they will need to make a decision. So if it says 30 micrograms or not more than 5 micrograms or whatever it is, that is both accurate and that consumers are able to understand what that really means for them, so they can make those informed decisions. And then I guess the last point to make there, of course, is that we need to be very careful for the most vulnerable people in society. We need to think about children in particular who I think it's too much to expect a small child to understand what 5 micrograms of an allergen might mean. And of course, people who may not be used to reading this information. For example, if English is not your first language, is this going to be an additional barrier to really understanding what that means? So I guess what I'm saying is a guarded, yes, I can see a place for this, but I think we would want to be really sure that it was helpful to people and not leading to the kind of confusion that the questionnaire has raised. I don't know if Adam or Rebecca, you have thoughts on that too.
We come to Rebecca first. I can see you put your microphone on.
Okay, yeah, thank you. I think from a consumer point of view, I think generally they find that having accurate information on food labels is the priority. But at present, they find that allergen labelling is already confusing. And the precautionary allergen labelling in particular is a big issue. And causes a huge amount of frustration in children, adolescents, adults, parents. And that isn't as accurate as it could be. So sometimes it'll have precautionary allergen labelling on it and they could eat it, no problem. And other times there's no PAL labelling, and yet there is something in there that could cause a reaction. So I think we need to get allergen labelling right to start off with, how it is now, before we start adding in new things which could be even more confusing. And I think Adam might have something to say on the clinical side of things, but we know that a reaction one day could be very mild, a reaction another day could be very severe, and there's lots of things that have an impact on that, like lack of sleep, like how much alcohol you've had, like how well controlled your asthma is. So providing information on the level of the allergen is not always going to directly relate to the level of a reaction. So I think I would be hesitant in saying that it would be a good idea to put something like that on. I think it might lead to more risks and more reactions in people. And I think what they would really like is to have our current level of allergen labelling to be less confusing and provide them with more information to make a decision without cutting down their choice.
Yeah, I think we always have to be careful of that law of unintended consequences that nobody sees coming, and there's always a danger of that. I think two things. The first is to say is that, of course, very strongly advocate for better labelling, but one of the keys to that is consistency, and I think that's where we're not quite there with that yet. As you said, the lack of consistency around may contain labels and what they mean and whether they're there or not is infuriating for consumers, of course. But I think we also need to recognise that there's no perfect here, and that there is never going to be a scenario where there's not going to be a need for risk assessment by the individual. That's always going to have to be there, however much information you provide, because exactly as Rebecca says, there are a whole raft of variables here about your state of health, whether you're carrying your medication, whether you're somewhere that you could easily call for help, that are going to impact. So whilst more information is usually better, it's what the best way to present that is. I'll be honest, I'm not sure. We need very broad consultation with consumers. What we definitely need is consistency of how that's done across everything. What we definitely need is our patients to be as educated as possible around how to risk assess, how to recognise reactions when they happen, and how to deal effectively with them.
Thank you very much. Yeah, some really interesting issues raised there. So moving on now, we've got a couple of questions about food businesses and how food businesses and consumers interact to make sure that customers get the right information. So the first question is about, so the questioner has said that in their view, the level of knowledge and understanding of allergen requirements, particularly in SME businesses, that's smaller businesses, is fairly low. Do the speakers think it would be worthwhile or practical to have improved allergen training for food handlers? And I think I'll say a few words from my perspective first. So I think there are two parts to this question, and I sort of think back to if any of you were watching the little video clips in the break, you'll have seen the one, I hope, where some people in a restaurant ask about an allergen, and the young man who's serving the food sort of firstly says, right, I know this is important, so acknowledges that it's an important issue, and I know what to do. So I think it's unrealistic, clearly, to expect every food handler, food server, member of staff in a business to know all about allergens themselves necessarily. But what they must do is they must know where to find the information that their company provides and what to do, who to ask. And so, for example, I know many businesses, certainly some restaurants will have a designated member of staff on each shift who's the person that you can go to ask about allergens. And in the case of our clip, that young man went into the kitchen and was planning to consult the chef to find out actually what was in the food on that day. I'm just looking to see. I think Adam. Oh, so Adam, you'd frozen. I was just checking. It wasn't me actually, but I think we're okay. So just let me know, our technical support staff, if we're having any connection issues. So I think there are two parts to this. Definitely, from an FSA point of view, we want to support businesses as much as possible to get that allergen training right. And I absolutely agree. And we can certainly see from some of the very sad cases that were mentioned earlier on in our morning's presentations that, there are occasions when it goes wrong, and that can have very serious consequences. I wonder if I could bring in perhaps Rebecca first, and then Robin. I'm still, Adam still, it's a bit frozen on my screen, so I'll perhaps come to him last. So any observations you have about the capability of businesses to make sure that customers have the right information, and anything more we can do? Rebecca.
Yeah, I think I'll speak from what we know from a consumer's point of view, and particularly what we've learned from the food sensitive study and some of the other studies we've carried out where we've interviewed members of staff in SME businesses as well. And I think on all sides, more training is always going to be beneficial. I think for our consumers, they've told us that they're not all that confident in the verbal information being provided by staff. Less confident than in written information. So if staff go and get them some written information, they can have a look at it. They're much more comfortable and confident in that information rather than what the staff's telling them verbally. So, and that's having an impact on their quality of life and their ability to eat out in a way that provides enjoyment and not anxiety. So I think doing things that can improve our consumers' confidence in the training that staff have had is going to be very beneficial. I think when we've spoken to, I ran a study a few years ago with an MSc, a master's student of mine, who interviewed members of staff in SME businesses about food allergy and food intolerance. And it was clear, again, that a lot of staff said that they would like more training. They didn't understand differences between allergy and intolerance. They didn't understand perhaps the different levels of reactions people might have. Chefs in particular were saying things that were a little bit concerning about, well, no, it's fine if they have a little bit, it won't be a problem. And so I think from all sides, it's definitely would be beneficial for more training. Just how we do that and how we then get that over to consumers, that more training has happened and be perhaps, help improve the confidence in the information being provided is something we should focus on, definitely.
Yeah, thank you. That's really interesting to hear, and I think we, again, we heard earlier. I can't remember. I think it was Adam, wasn't it, who was talking about some of the myths and the myth that just a little bit isn't going to make a difference. So I think there are definitely some things that everybody involved in food preparation and food provision needs to be aware of. I think the question about the difference between an allergen and intolerance and that sort of thing, it's quite interesting. I mean, one of the things that from a customer service perspective, I think, if a customer comes into your restaurant and says, I can't have anything, or I don't want to have anything, if they're requesting food that doesn't contain a particular ingredient, I would have hoped that the restaurant would respect that choice. And I would just say very strongly, it's not for the food server to think, well, are they really allergic, or is it just a lifestyle choice, or perhaps it's an intolerance. So I think there are, from a customer service perspective, what I'd like to see is businesses respect what a customer has asked about and know then exactly what to do. But also, as you say, to really understand that for food allergies, particularly the kind that we heard Adam Fox describe, the ones where the reaction can be immediate, the consequences can potentially be severe, fatal, and you can't judge what quantity of ingredient will induce that reaction. So we've got another question about sort of businesses and how they approach this. Question says, do you think we've got the balance right between wanting to give consumers choice where they can eat and pressures that food service businesses feel to provide a guarantee of free from food that may not be possible? So that's another interesting question, and I wonder if I think Adam, are you with us still? You had frozen earlier, but I see you're back. I wonder if you could comment on the concept of free from and how useful you think that is in both in a restaurant environment but also in food production.
I think there's always that little bit of danger, isn't there, that it gives you that false sense of security that somebody else understands things that maybe they don't quite understand as well as they should, that's providing that. So I've had this conversation so many times with people around school environments and having these nut-free schools, and the parental concept sometimes that we don't have to worry about nuts allergy when my child's at school because it's a nut-free school. There's definitely no nuts. And explaining that whilst they, as a parent, they're taking that nut-free policy extremely seriously because their child's got nut allergy, that other parents just aren't, because they just don't take it, and they're just not as worried about it, and that we're therefore creating this slightly risky environment where you believe you're safe, but actually you're not, and you probably will be okay, but you might not be, and it'll be luck, not judgment. So similarly, I think that I would much rather that we're moving towards an environment where there's just full declaration of everything. And people can make their own individualized decisions because they know what their allergies are, and it's reliable and accurate information, rather than this risk of sort of being really big about free from, when actually it might be free of something but not free of something else, and it just leads to additional confusion.
Yeah, thank you. I think it's a very helpful answer. And then I'm just conscious of time. So one more question about food businesses, an interesting question about the relationship between the business and the consumer and the balance of responsibility. So a question about what responsibilities do consumers have when they're using a business that doesn't make these doesn't have these guarantees or these free from guarantees. And I think we're always really clear in the FSA that the regulatory environment that there are responsibilities on both sides. So obviously, clearly it's up to consumers to understand their condition, informed by their doctor or their clinician, and to ask for and make sure that they have the information they need in order to make their own choices. But it's very clear in the law that food businesses, they have to know what's in their food and give consumers that information, and they have specific responsibilities relating to allergens and providing that information. So they are required by law to do that. And as we've discussed earlier, for different types of food and different environments, there can be different rules about how that is done, but that basic responsibility is there, and it's very fundamental. So in order for food hypersensitive consumers to be protected and to be safe. Both of those things need to happen. The business has to know what's in the food and provide the information. The consumer needs to know what information do they need as an individual in order to make the right choice. So, which is why a lot of our work and a lot of the work that we do in terms of the public awareness campaigns and the support for consumers is about encouraging that dialogue. How to make that dialogue constructive, and to sort of focus in on groups like younger people who may find it harder to initiate those conversations and not quite be ready to ask for the information they need. The other thing that we do a lot of, and I know we've touched on this earlier today in some of the presentations, is we're thinking very hard and looking at the evidence about how should the information be presented? Because some things that may seem straightforward, such as having written information. We're thinking for example, in a busy restaurant environment, ingredients can change quite quickly. That might go out of date. So there's no one fail-safe way. It often needs to be a combination of different sorts of information, whether it's a label, printed information. There are, some restaurants have got digital tools now available, which I'm sure lots of you might have used. Conversation with the member of staff, look at the allergy guide, ask the member of staff to speak to the chef. There are lots of ways, and it will depend a little bit on the environment and the kind of allergy, what's going to work best for the consumer. So there's a lot to think about. I think probably, actually, I'm just thinking we probably don't have time for any more questions. A couple of questions, just jumping right to the end. Adam, just a couple of questions you might be able to answer very quickly about why sometimes cooked foods, so egg and milk, are less risky than uncooked food. Maybe if you could cover that.
Sure. So it's very specific to milk and egg, because a large proportion, about 80% of milk and egg allergic kids, are allergic to proteins in the milk and egg that are actually quite heat sensitive, and that when you extensively heat them, so bake them, particularly when they're mixed up with wheat, so in cakes and biscuits, it actually changes the shape of the protein to a degree that your immune system won't recognize it anymore, and hence it won't cause allergy. So it turns out that most children with milk and egg allergy are okay with baked egg and baked milk, and there's a strong suspicion that eating those things regularly can actually help you outgrow the allergy sooner. So they actually are helping to desensitize you. But clear caveat, don't try this at home. It's hard to predict which kids will be okay with baked egg and which ones won't. So speak to your doctor about it. And lots of times they'll invite you either into the hospital or even give you a guide to do this at home to try it. But it needs to be done carefully, because if you're not okay with it, then you can still have a bad reaction.
That's, again, really clear and helpful advice. Thank you so much. So coming up now to the end of the morning session. So very warm thanks to our speakers from this morning, Rebecca, Robin and Adam. So we're now breaking for 45 minutes. If I could get everyone to come back promptly at 1:15, and Robin is going to be your chair for the afternoon session. And I'll be leaving you at this point. Please do, again, if I can remind you, visit the virtual exhibition stands, and really encourage you to contribute to our social wall, where we weren't able to pick up all of the questions in the chat. So, perhaps you'll be able to exchange a bit of information and share your views there. So thank you very much, everybody. It's been a great morning, and I hope you're looking forward to this afternoon's session. Thank you. Goodbye.